All right, so we are going to jump into the antidiarrheals and we will get going here. If you work in healthcare at all, you will have patients who have diarrhea, right? And diarrhea can be problematic. And so it's important to know that you may run into Lomotil. Lomotil is a medication that can be given to stop diarrhea. And it is called an antidiarrheal, right? That's the classification that it sits in. Imodium is also another medication that sits in that classification. And I'm just showing you just what it can look like in different forms. And so we're going to be talking about Lomotil and loperamide. So there are two prototype meds that we do look at when we look at antidiarrheals. One is a prescription that is the diphenoxylate with atropine, which is also called Lomotil. And the other is the over-the-counter drug loperamide, also called Imodium. So when we get to opioids later on, you'll find that opioids are used for pain. Well, opioids have a nice little side effect where they cause constipation. They decrease peristalsis. And so that is useful as an antidiarrheal. So these are antidiarrheals, very, very mild opioids, decreasing intestinal peristalsis, which in turn then helps it kind of slow down so that it's not watery and frequent. Therefore, the therapeutic use is for diarrhea. Adverse drug reactions of these antidiarrheals that are opioids can include cardiac arrest and dysrhythmias. They can include drowsiness and constipation also. The drowsiness and constipation is actually more pronounced with the diphenoxylate and atropine. This is the one that's the prescription one. So the other thing that you need to know about these is that people can experience anticholinergic effects, especially with that atropine, right? Because that's what atropine is. It's an anticholinergic. And so anticholinergic effects, when we talk about anticholinergic effects, we just think back to that parasympathetic versus the sympathetic system, right? And then we look at the fact that this part over here, this parasympathetic side, is the cholinergic, okay? And this side over here is the adrenergic, right? And if we're anticholinergic, because that person is getting some atropine with that, if we're getting anticholinergic effects, it's anti, so it's against these cholinergic effects over here. So it's like we're going to see the opposite of these effects over here. So instead of stimulating digestion, the therapeutic effect with this is that we decrease that peristalsis and that movement through the GI tract, right? But we're also going to be blocking a little bit of this slowing of the heartbeat. So we're going to end up with a possible more accelerated heartbeat. Does that make sense? It also, we're going to end up with blocking this salivation. So we're going to end up with kind of a dry mouth. We're probably going to cause a dilated pupil. But we're also going to cause the person to not have a contracted bladder. So we might cause a little bit of urine retention. So those are anticholinergic effects that they're talking about. And we do need to think back to that sympathetic versus parasympathetic system. If you'd like a review of this, I can get you. So when we're looking at the side effects with the anticholinergic effects, we're talking about if they have the dry mouth, they can chew on gum or suck on hard candy. If they have urinary retention, we're going to monitor for it and notice it. Urinary retention over a prolonged period of time is going to lead to a risk of a UTI. But you know, this medication is not meant to be long term. Drowsiness and constipation, we're going to monitor for that and keep the patient safe, make sure they're safe when they're ambulating, that kind of thing. So also no driving. And change positions gradually, right? So I'm going to put these down next to the drowsiness and constipation areas, okay? This is not for young children, not for children under 2. Years of age. Then also, please, please, please do not give to the individual with, you guessed it, C. diff. C. diff is an organism which produces an endotoxin, and it's important for the body to actually shed that endotoxin and get rid of it so that it doesn't build up toxicity in the body. So the individual with C. diff needs to be getting rid of that toxin. Do not stop them up or that toxin will build up in their body. I just want to give you a little warning. C. diff sometimes, especially on NCLEX type questions, they like to call it pseudomembranous colitis. And that is what C. diff causes. It does cause a colitis that we call pseudomembranous colitis. But that's why, you know, I'm kind of using those things interchangeably, but the pseudomembranous colitis, enterocolitis, is actually what C. diff is causing. So it's really not recommended for those with liver problems. Those with glaucoma, severe fluid and electrolyte imbalances, any kind of diarrhea due to poisoning, the body is trying to get rid of that poison. So we just have to remember that. Ileus, we don't really want to be using it with that. Gastrointestinal bleeding. And then with the pseudomembranous colitis associated with C. diff. We want to use this with caution in those with liver problems, ulcerative colitis, kidney problems, chemical abuse, or prostatic hypertrophy. That liver and kidney problems, that's always, you know, metabolizing and excretionary types of things. Prostatic hypertrophy is because of especially the ones that have the atropine in them, contributing to more urinary retention. Finally, there are several different interactions with this. So caffeine will counteract because caffeine actually contributes to increased peristalsis. So the caffeine will counteract this medication. It'll work against it. The CNS depressants have an additive effect with it in the fact that a lot of medications that are going to decrease the activity in the central nervous system, this also can add to that decrease in central nervous system activity. Meaning anything that decreases your respiration rates can also work additively with these medications to decrease your respiration rates. MAOIs in conjunction with this medication can increase the risk of a hypertensive crisis. Increased risk of cardiac dysrhythmias can occur if this medication is taken with cimetidine, erythromycin, and quinine.